Ontario's COVID-19 cases are flat. Over the past 8 days, the three-day average has been between 180 and 186. 189 new cases are being confirmed today. This is a slight increase from the 163 cases yesterday. Sadly, 10 additional deaths are also being recorded. This brings the province's death toll to more than 2,600 people. And close to 70% of those COVID deaths in this province are from long-term care. And today, Prime Minister Justin Trudeau blamed provinces for failing seniors after a damning new study found the percentage of deaths in Canadian long-term care homes is twice as high as other OECD countries. And that is not going over well with Premier Doug Ford.
Our current system of supporting our seniors across this country has not worked. It is a provincial responsibility, so it is them who have failed to support our seniors.
What do you say in response to that?
Put your money where your mouth is. Help us out. We can't do it alone. You know, support us. He's been very supportive, by the way, but I'm a little shocked with his comment, to be very frank with you. We're supposed to be all in this together.
The Prime Minister's comments were in response to this study by the Canadian Institute for Health Information, which found the percentage of Canada's deaths in long-term care facilities during the pandemic made up 81% of COVID-19 deaths, while the average for other countries who belong to the Organization for Economic Cooperation and Development was 42%. Quebec and Ontario long-term care homes were hardest hit in Canada, and the military had to be called in to support homes that were in crisis in the two provinces. But Premier Doug Ford is disputing the study.
I just think it's a little unfair. They're comparing us to Spain.
But there is no doubt COVID-19 exposed deep flaws in long-term care across the country. The Prime Minister today suggested national standards could be put in place, something advocates have been calling for. The Ford government is launching an independent commission in July to examine its long-term care system in response to the pandemic. But a very real concern is how could long-term care homes that have been strained under COVID-19 possibly handle a second wave?
I think there's several things that we need to deal with. As the Premier said, that there are some of the homes are 4 bedrooms that are now 2 bedrooms, that we need to make sure that people are protected. We need to make sure that we continue to follow the safety precautions for visitors and for staff. We need to keep doing the testing on a regular basis.
Today, Ontario's Medical Officer of Health noted the continued rise in young people testing positive for COVID-19. 70 of the 189 new cases are in people aged 20 to 39, and he warns he's hearing anecdotal reports that younger people who had COVID are experiencing prolonged issues. And he says if they don't think they have to worry about getting seriously ill, they should think again, because this is a new disease and no one can say for sure what the long-term effects are.